webinar. Thank you all for joining. Today, this is an orientation webinar for Second Chance Act grantees for fiscal year 15 Reentry program for adults with co-occurring substance abuse and mental disorders. On today's webinar, we'll have three speakers. Maria Fryer, who's a policy advisor for substance abuse and mental health at the Bureau of Justice Assistance, U.S. Department of Justice. We'll have Leah Harrington, who's the Assistant Superintendent at Essex County Sheriff's Department in Massachusetts. Leah is also a fiscal year 14 Second Chance Act co-occurring disorders grantee. She will talk to us a little bit about her experience as a grantee, tips that she has, as well as how the Planning and Implementation Guide has been used in her jurisdiction. Then I am Sarah Wurzberg. I'm a Grantee Technical Assistance Manager for Behavioral Health at the Council of State Governments Justice Center, and I oversee technical assistance for Second Chance Act co-occurring grantees and the Justice and Mental Health Collaboration Program grantees as well. So to start off, I'm going to pass it to Maria to talk a little bit about the Bureau of Justice Assistance.
Hi, good afternoon. This is Maria. The mission of the Bureau of Justice Assistance, of course, is to provide leadership and services in grant administration and criminal justice policy development to support local, state, tribal justice strategies to achieve safer communities. And similar to that mission, you each share a common goal to effectively serve people returning from jails and prisons and to promote positive system-wide change. So this year we have 10 new co-occurring grantees and 76 previous grantees, and that's a lot of experience to assist you, I'm happy to say, and congratulations. And you can expect that we will support and assist you as you set out to reach the goals of your program. Both the program staff and the policy staff will be responsive to your inquiries as they arise, whether they are technical, such as allowable uses of funds, or changes in key staff, or requesting no-cost extensions, or whether they are questions regarding changes at the state, county, or local level that may impact your program. Thank you.
Thank you, Maria. So for today's presentation, we are going to go through some additional introductions. We'll give a little bit of an overview of the Second Chance Act Co-Occurring Disorders Grant Program. We'll talk about the Planning and Implementation Guide that's a requirement of the grant. We'll talk about grantee support and also have an example of the Grantee Experience provided by Leah Harrington from Essex. We'll also leave time for questions and answers. If you have any questions, you can also use the chat box at the bottom of your screen to ask questions. We'll make a list for those to be asked at the end of the call. To begin with, the Council of State Governments Justice Center is a national nonprofit organization. We provide bipartisan policy solutions to all three branches of government. Some of the topics that we work on are things like the intersection of behavioral health and criminal justice. We also work on employment issues, school discipline issues. We have a juvenile program, and we work on other issues such as justice reinvestment in various states. The Council of State Governments Justice Center, in conjunction with the Bureau of Justice Assistance, runs the National Reentry Resource Center. This was authorized by the Second Chance Act grant in April of 2008. In October 2009, we started providing technical assistance to all of the Second Chance Act grantees. This includes over 600 juvenile and adult reentry grantees since the beginning of the grant program. This is a copy of the Justice Center website, and the reason we're pointing this out is because you can subscribe to our newsletter. It also has a lot of resources, so we really look at ourselves as the National Reentry Resource Center. Our job is to provide resources both online to people around the country as well as the technical assistance we provide to grantees. We also have newsletters for reentry and behavioral health that give content for things that are going on both at the Justice Center and nationwide. We do grantee spotlights and things along those lines. So it's certainly something that you should subscribe to make sure you keep connected on what's going on in reentry around the country. So now we're going to talk a little bit about the Second Chance Act Co-Occurring Disorders Grant Program. First of all, congratulations. This is, the states are highlighted from which all of the grantees come from. So as you can see, we have a lot of geographic diversity from Oklahoma to Oregon to Massachusetts. So we're really excited to see this pool of grantees. This is a list of the other grantees. So Atlanta, Georgia, we have folks in Ohio. We also have a tribal grantee as well this year, in addition to several state grantees. At the Second Chance Act conference, you'll also have the opportunity to meet all of the other fiscal year 15 grantees. So if there are grantees on this list you think might be from similar areas, we'll make sure that you're able to connect at the conference. So right now, you have been going through the grantee orientation process. The Bureau of Justice Assistance and the National Reentry Resource Center did an orientation webinar on Thursday, October 22nd to go over some of the basics of grants management and a little bit about our technical assistance. For the co-occurring grantees, we also have this orientation webinar. There are also orientation calls, which at this point have taken place with all of the Second Chance Act co-occurring disorders grantees. So you've had a chance to meet with one of our TA providers, and we're excited to be working with you. The goal for this webinar is to dive in a little bit more on some of that technical assistance content. So as was probably mentioned on your technical assistance call, there's three major centers that you'll interact with as part of your Second Chance Act grant. The Bureau of Justice Assistance, on this represented by Maria Fryer, is the funder, and they also have a programs department which provides state policy advisors. The state policy advisors will be your point of contact on budgets and grant adjustment notices. The National Reentry Resource Center, we provide the training and technical assistance, which will include monthly calls, potential for site visits, and the conference that we're putting on in December in Washington, D.C. CSR Incorporated is another government contractor from the Bureau of Justice Assistance that developed the Performance Measurement Tool, or PMT. So if you have questions about inputting data or what types of answers you should put into that tool, that would be someone from CSR that you should contact. I'm going to pass it off to Maria to talk a little bit about the purpose and some of the guidelines for the Second Chance Act Co-Occurring Disorders Grant Program.
Thanks so much, Sarah. So the purpose of the Second Chance Act Co-Occurring Disorders Grant Program, of course, is to increase screening and assessment and improve treatment to adults with co-occurring substance abuse and mental health disorders, reduce the use of alcohol and other drugs, and reduce recidivism. Through the increased use of screening and assessment, of course, we can identify those in need of treatment as soon as possible. It's better for both staff and inmate when considering potentially behavior management options and providing needed treatment. And treatment for those with co-occurring disorders is a specialty known as, I know you all well know, is integrated treatment. And it is a specialty. Integrated treatment provides better outcomes, such as reduced substance use, improved psychiatric symptoms and functioning, decreased hospitalization, increased housing stabilization, fewer arrests, and overall improved quality of life. Next slide. So expectations, of course, to complete and submit a required planning and implementation guide, and we're going to hear a lot more about that a little bit later. The planning and implementation guide helps each program to work through their unique goals and objectives. And although each plan is different for each program, it'll help you work through all that is basically required for the implementation phase of your program. Your TA provider can help you to complete the planning and implementation guide. And as you can see by the slide, you can access up to $50,000 while completing the guide, and it may take several months to complete. Next slide. Uses of funds for planning phase. So during the planning phase, you will focus on many activities. Could be program design, the integrated care model, the implementation of healthcare services, the current provision of screening and assessment, pre-release treatment services, post-release programming, and overall improved and enhanced use of screening and assessment to ensure that the proper individuals are selected for participation in the most appropriate programming to ensure the best outcomes for program participants, and to engage in strategic planning to ensure long-term system change and sustainability of your program. Next slide, please. The planning phase is designed to build capacity, identify strengths, and target technical assistance, and identify themes across for all grantees. It provides the ability to create a learning community, connecting grantees with one another, and provides a working document to follow. And all the feedback that we can get through planning and implementation guides is very helpful to all grantees. Next slide, please. So the use of funds for implementation. And as you can see from this long list, these are all the allowable uses of grant funds during the implementation phase. And it's, in a way, a combination of all the objectives that you bring and carry out in your programs, such as the use of evidence-based practices in screening and assessment and treatment of participants in data collection and sustainment planning. I'll hand it back to Sarah.
Thank you, Maria. We're going to move on to talk a little bit about the Co-Occurring Disorders Planning and Implementation Guide. So the planning phase process, the goal of this is really for you to work with your team of stakeholders to complete the guide, to provide honest and accurate information through brief answers. And we understand that everybody's in the planning phase, and nobody is going to have completed all of the things that it asks for. We're just looking to get a feel for the types of things that you're planning to do through this grant. You'll be filling out the exercises with your technical assistance provider on the NRRC monthly calls. So ideally, the process will be that you'll decide on a number of exercises, let's say 3 for the first call, and you'll send them to your TA provider prior to the call, so your TA provider will have the time to review. Then you'll be able to discuss the content of those exercises on the calls, and update the exercise based upon the conversations and the deeper dives with your technical assistance provider. So grantees will fill out the exercises, as I mentioned, and we're able to adjust the timeline for doing the planning implementation guide based upon the needs of the site. So for some sites, it may take a few months to do the planning and implementation guide. For other sites, it may take longer or close to a year. It really depends on what works for the site. You can work with your TA provider to discuss the appropriate timeline. You'll also work with your TA provider to set up recurrent monthly calls. So we'd like to have those on the calendar for each grantee, in which we're able to review and work on the responses with you, so we can get all of the grantees from the planning phase successfully to the implementation phase. So how do we use the P&I Guide? A big goal of the P&I Guide is so we can identify themes for grantees across the sites. So what are things that we know that all grantees are doing well? Or let's say one grantee has a really great screening process and another grantee is struggling with that process. That could potentially be an opportunity to connect these grantees through peer-to-peer learning. So it helps the TA providers target our technical assistance. If client engagement in the community, for example, is an issue across sites, that's something that maybe we could have a webinar on for all of the grantees so everybody can get that information. It also enables us to target best practices in a way to better exchange ideas. So a lot of this process is working with your TA provider through these discussions to also suggest other ways to improve the process as we go along, through learning about what you're doing and what other sites are doing. There's 3 sections to the guide. The first section talks about developing the collaborative work group, and that work group will really be the key to filling out your planning and implementation guide in a comprehensive way. The second session is about evidence-based practices for reducing recidivism and promoting recovery in your program. So it talks about recidivism reduction, your target population, and evidence-based practices, as well as services you'll be providing. The third section is this larger section of data collection, evaluation, and sustainability. So what types of things are you collecting? How are you measuring recidivism in your program? And what steps are you taking in order to sustain the program, such as marketing your program or developing a plan for how to create sustainability in your program. So the first section will go over background information, so just basic things about the grantee to make sure we're all on the same page with the goals and the plans. If there have been any major changes from your program narrative to now, that would be something that would come up in this background section so you can discuss it with your TA provider. The work group will outline the team members and those who are interfacing with the program. So it'll give us a sense for who you'll be collaborating with and how those individuals intersect. It also gives an opportunity to share these successes with those stakeholders throughout the process, as well as make sure that they're involved in developing your planning and implementation guide. Section 2 works to identify your target population. So this really looks at how did you decide on who you will be targeting for this program? What is the eligibility criteria? We want to make sure that everyone going into the implementation phase has clear steps laid out for how people will be referred to the program and how people will be successfully completed, discharged, and things along those lines to make sure when you hit implementation phase, you're ready to start enrolling within a short period of time. We'll also go over screening and assessment practices. This is a key part to deciding on who is in your program and how you actually share those amongst your partners, such as community supervision, jail staff, behavioral health staff is another important piece that we will discuss, as well as pre-release and post-release services. So this is also an opportunity where we see a lot of themes. For example, if there are multiple jurisdictions providing certain evidence-based practices, the opportunity to connect those folks on how they're providing that and if there are any successes or challenges in that process. There is an additional section part is assessing the transition process. So how are case plans developed in the facility and as individuals reenter the community in order to follow the individual out? Or is there a connection to community-based providers? Do those community-based providers do in-reach to the jail or prison facility? We also talk about connections to healthcare coverage, which can be an important piece of sustainability for a lot of these programs, connecting to Medicaid, SSI, SSDI, food stamps, other services, accessing housing vouchers. We also talk about community supervision strategies. The partnership between community supervision officers and community-based providers is often a very important piece for these co-occurring disorders grant programs. We want to make sure that these two entities are talking to each other and working together to make sure they're doing the best practices. In Section 3, we'll talk about data collection and evaluation. So are there specific measurements that are going on, how you're working to track your recidivism rates. We'll talk about measuring the capacity for process review, so identifying which partner has what information and how that information is shared. So is the data shared electronically? Do you present it to the stakeholders at meetings? How is the outcomes communicated amongst the stakeholders so everyone's aware of successes, whether they be a small success of getting someone to initially engage in the community-based treatment, whether it be a larger success of program completion for an individual. We'll also talk about assessing and planning for sustainability. So how are the stakeholders engaged in order to have this discussion about sustainability? Are there local foundations or nonprofits that have been identified as potential funders? What other federal grants might be available in order to continue this work? How can you work with your local or state behavioral health agency, Department of Corrections, or Sheriff's Department in order to try to sustain this components of this program moving forward, as well as what components of the program could be sustained even without additional funding. Let's say you've trained in an evidence-based practice, so you wouldn't actually need to retrain staff on that. You could still have that regardless of what's to happen. So now we're going to talk a little bit about the grantee experience and support that we're able to provide at the Justice Center. So I'm going to pass it over to Leah Harrington, who's the Assistant Superintendent of Essex County Sheriff's Department in Massachusetts. She'll talk a little bit about her experience as a fiscal year 14 Second Chance Act co-occurring disorders grantee.
Thank you, Sarah, and congratulations to all the 2015 grantees. I'd just like to start off by saying Essex County is really grateful for the opportunity to be able to work with the Council of State Governments and BJA with the expertise that we've received from the technical assistance. Mark Stovall is my technical assistance provider for the Second Chance Grant, and he's been an excellent resource for questions that we've had while trying to answer the P&I Guide along the way. And very resourceful and very just great ideas if we were stuck on a question on how to handle that. So some of the things that we've realized after completing the planning and implementation guide was it brought us together, even though we had a grant in place, a plan in place, to have all the parties that were included in our Second Chance application to work together. So we have the Sheriff's Department, we have UMass Lowell, which is our data and evaluation piece. We have Volunteers of America, which is doing the reentry piece, and we have AdCare Criminal Justice Systems, who's doing the clinical piece. So it brought us all together in a room where we could look through the P&I Guide together as a team, and it started us creating our collaborative strategy on how we're going to go about what we wrote to implement. It kept us on track. It gave us a timeline, even though there was a timeline in the grant of how we want to go about things. It also showed us individual orientation on how we're going to provide risk, needs, and responsivity. We had certain risk assessments in place that we were going to use, but through the conversations, through the planning and implementation guide, it brought us to recognize that we might need to change the mental health screen that we were going to use. Maybe the jail had to change some of the processes in their intake procedure. So there was a lot of good things that came out of the P&I Guide. It is we were a Second Chance grantee in the past when we did not have the P&I Guide, and I feel as a second Chance grantee, the process of completing this guide has made us more successful to date. Where we're at, we're only 10 people away from our target population. Also, one thing I felt that was important through the P&I Guide with us is our grant is data-driven, where basically we have a process evaluation along with an outcome evaluation. So the process evaluation, we have our evaluators from UMass come to our monthly meetings that we set up to ensure that we're on track based on our P&I Guide, and he assists us with avenues for us to move in the right direction to get to the goal that we promised BJA. The other things I feel that are good to work, that are not necessarily to do with the P&I Guide, but can be helpful as a new grantee is, firstly, working with your fiscal procurement department to ensure that the money has transpired. I know for Massachusetts grantees, and I'm sure it's similar in other aspects of the country, to make sure your fiscal and procurement places are in place to get your money drawn down when you need the money. Set up a nice repertoire with your state policy advisor, because she's the one who's going to help you process your award paperwork and also assist with any other questions you might have not related to technical assistance for your grant. The PMT reporting, I think that Sarah mentioned earlier, maybe it was Maria, I'm sorry. That's an intensive amount of work, and once you submit that information, you can't take it back. So you can print the questions out ahead of time, and I think it's an important piece to work out with your group on whose responsibilities that will be, and have that sent back to you in an appropriate timeline so that you could submit it and review it as the project manager of your application. Also, for people who are new grantees as well, the grant management system, it's a great resource that you're going to have to use to submit your PMT and fiscal reports, and it takes a little bit getting used to. It is user-friendly. You just need to play around with that a little bit. You wouldn't want to wait until your reports are due to try to figure out how to utilize GMS. Other than that, I think that's about what I have to on that.
Great.
Sarah,
thank you.
Much,
Leah. We're so appreciative to have Leah's willingness to get on the call and talk a little bit about her process. And if you have, any questions for Leah or any of the panelists, you can feel free to chat it in the chat box. After I go through a little bit more about the type of technical assistance we provide, we'll be able to ask Leah questions as well as Maria and myself. So NRRC technical assistance, we work with you to complete the P&I Guide. We also work to identify measures and strategies to track progress for your grants. The P&I Guides, once we finish the planning sections, we're also able to come back and review specific portions of that. So if there was a change in the facility and one of the services you provided has changed, we're able to update the guide. We really view the guide as a living document, and we want it to be useful throughout your grant period and for your team in general to have a reference point for where you were and where you've come in the long run. We also are able to help with talking about successes in your program and connecting with other grantees who have highlights of their successes as well. So how do we provide this technical assistance? Through the monthly calls, I think our TA provider has been working with some of you to set up these monthly calls. We also provide peer-to-peer learning opportunities. So as I mentioned, if there are specific topics that are of interest to certain sites, we're able to have a peer learning community about that. One example is I was working with youth grantees, and a lot of them were having issues with gang-involved youth. So we had a peer learning community to talk about how each of those grantees were handling that issue. So if you have thoughts or ideas on specific topics that you'd like to really talk about with other grantees, please reach out to us, and we're happy to help facilitate that process and figure out whether it is appropriate to create a learning community out of that. Also at the conference, you'll be meeting with a bunch of the other grantees, so we hope to identify areas there where we could develop these peer learning communities. The National Reentry Resource Center hosts webinars on behavioral health as well as other topics such as employment, education, mental health court specific things. A lot of our, we have webinars on topics like screening and assessment, working with individuals with trauma, so a lot of these will be really applicable to the grantees. The TA providers will be sure to flag these for you, but we also would recommend that you subscribe to our email listserv so you'll have an opportunity to get those yourself. NRRC also has experts on staff as well as outside consultants who are able to provide training. Some of these will be web-based through webinars and things like that, but for a select number of grantees, we're actually able to go on-site and do a site visit. Site visits really range in the content based upon the needs of the site. Some sites will be talking about a process flow of how someone actually gets through their program, what services they're provided, and if there are any issues along any of the points in which the individual goes through this program. Other site visits could be specific trainings on gender responsive services or risk needs responsivity principles. It just depends on what is needed for those sites. We're also able to share resources, and this could be research. It could be information from other sites. We're able to do it through email. We're also able to do it, again, through webinars and peer-to-peer learning. Some examples of technical assistance include discussions on data collection and analysis. This is certainly a big topic where we have a lot of questions on, and we're happy to work through and discuss how other sites track recidivism data, as that's often a big lift for sites who haven't been able to do it in the past. We also help with strategic planning sessions and reentry task force meetings. So that's something that we're able to do remotely through calling in or sometimes on-site visits, or if there are specific topics that we could potentially help facilitate one of those sessions. We do training on various topics, including recidivism reduction, promoting recovery, and improving other outcomes for programs. So motivational interviewing, for example, is a topic that we cover with a lot of grantees. So that's another type of training that we're sometimes able to provide. Really, our overall goal at the Justice Center is to translate research and policy into practice. So a lot of what we talk about is bringing it back to some of the research components. So you're looking for an appropriate evidence-based practice. How do you find what types of evidence-based practices are out there and decide on what would match specifically to your population? So those are the types of things that we can help with. Or you want to know more about risk assessment tools. You may have been using a tool, you've been using it for a number of years, and you want to see if there's something else out there that might be better. We're able to send you research on that. We're able to use in-house expertise to have discussions about those topics. Lastly, supporting the development of implementation and sustainability plans. So a big goal of these grant programs is we want everyone to be able to sustain the great service that they're providing through this grant. So we really want to make sure that we put everyone in a strong position to have plans on sustainability so they'll be able to sustain components of the programming, particularly the co-occurring disorder programming in jails and prisons and as people reenter the community. So the Second Chance Act Conference is being held from December 16th through the 18th. Everyone on the line should have received information from about the Second Chance Act Conference. We're looking forward to holding a number of sessions. We're expecting about 1,000 people, or a little bit over 1,000 people to attend the conference. So we'll have plenary sessions on topics like sustainability, systems collaboration, trauma. We'll also have workshops on topics like cultural competency, screening and assessment for behavioral health practice, risk needs responsivity, how to select a risk assessment tool, things along those lines, as well as education, employment, and various other topics. So there will be a lot of content that you'll be able to choose from. We also have opportunities for fiscal year 13, 14, and 15 Second Chance Act co-occurring disorder grantees to get together and have discussions. We'll have a specific session just for fiscal year 15 grantees to talk a little bit more about the cohort for you to get to know each other. You'll also be able to meet some of the 13 and 14 grantees who can provide you with additional information and guidance just like Leah is able to in order to help you think about some of the challenges as you get started on your process for implementing your program. So now we have a time allotted for questions and answers. So if you have any questions, please put it in the chat box. So there's one question I have for Leah. Leah, can you talk a little bit more about your partnership with your evaluator?
Sure. Hello?
Yes, hello. We can hear you.
Okay, sorry about that. Sure, yes. And if I'm not answering the question as you would like, just please let me know. We partnered during the application process with University of Massachusetts at Lowell to provide us with the process and outcome evaluation of our Second Chance co-occurring grant. So what that means is we're doing a study based on recidivism, and there's all sorts of data tracking that goes along with that. And then there's also a process evaluation, which they are monitoring and evaluating how we interact with each other and work together as a team to make this process work, that we will report 2 separate reports. One is the outcome evaluation, and one would be the process evaluation on how we work together as a team, because that could also, the process evaluation can show why the outcome evaluation doesn't work, because it could show like maybe the Sheriff's Department didn't communicate or didn't get the clients over, the inmates rather, over to be assessed for with the K-5 assessment, or so, and they help guide us in the direction we need to go. Because, you know, the baseline of most of these applications that we apply for how do you validate things? Through data, right? So if you don't have somebody helping you, nobody in my department anyway is an expert on data, so we looked at UMass Lowell or a research school to help us, provide us, to guide us in the direction we need to go and make sure that we stay on track. And we're really fortunate to have Dr. Tracy and Dr. Karkin on our team assisting us with this process section of our evaluation as well as the outcome. I hope that answers your question.
Thanks, Leah. So there's actually a question that's tangentially related to that, I think, once you start talking about data. So how hard was it for you to start answering the PMT questions, and what did it look like to set up information to track through PMT?
How I set it up with my team, because we have four different agencies, including us, we have 4 different agencies. How I did it was I sent everybody a copy of it, and as the project manager for the application, I highlighted areas that I felt people should address. We then had a meeting. We have a monthly meeting that everybody attends, and we kind of worked through it in the beginning. Questions we had trouble with, that's where I utilized my TA advisor, and I'd say, we're kind of stuck on this one. What is exactly that you're looking for from us? Are we on the right direction with that question? I would track it by, and I don't know if this is the answer what you're looking for. I would keep the hard copy in my file, and people would send me back their answers or send them in an email, and I would keep the hard copy running as the project manager for the grant. I hope that answers your question clearly.
Great, thanks, Leah. We also had another question, which was, are process and outcome evaluations required or just recommended? So,
can you say that one more time?
So this is a more general question, but it says, are process and outcomes evaluations required or just recommended? So for the fiscal year 15 solicitation, they are highly recommended, but not required. There is another question for Leah. So regarding the PMT questions, did you discuss these with your TA provider or stakeholders?
I discussed them with my stakeholders, and I set the tone of which direction that we should be going in. Everybody, I think it's really important also to make sure that you do some sort of, not even conference calls are great, but if you're all in the same vicinity, to sit down in a room once a month and discuss what's going on. The PMT guide should be part of your first meeting, because it kind of sets, it'll assist you with your planning and implementation guide as well, because these are questions that need to be answered in the future, and people should be thinking about them as they proceed, in the implementation, in the planning phase of what their work of their project. So yes, you could also use your TA guide for assistance, but it's the majority, I feel, of the stakeholders you have in your group. And if they have questions, you can resort back to your technical assistance guide to assist you with that P&I guide. If you had questions on, am I using the right risk assessment tool? Am I, things of that nature. I hope that answers your question.
It does. They put thank you in the chat box. So anyone who has additional questions, you can feel free to chat it in. I think there's a question for me, which is, what is the timeline for completing the planning and implementation guide? And as I mentioned before, we actually work with the grantees to develop an appropriate timeline with the grantee. Some grantees may, complete it in 6 months. Others may take 8 months or a year. So it really depends on what's going on in that jurisdiction and the amount of groundwork that's already been laid with the collaborators and the stakeholders. So that's variable would be our answer, and we can certainly connect you with your TA provider in order to develop a timeline that's appropriate for your program. So again, if you have any questions, please feel free to put it in the chat box. I'll give it another 30 seconds to see if anyone else has any final questions. Okay, so we're not seeing any more questions. So I want to thank Maria and Leah for both joining the call and providing some valuable information on the grant program and experiences as a grantee. I also want to thank all of the fiscal year 15 grantees for joining on the call. Just reiterate how excited all of us are to work with you. We look forward to meeting you in December at the Second Chance Act Conference and for giving you the ability to connect with each other. If you have any questions in the meantime, please feel free to contact us. We have the contact information of myself and Mark Stovall from the CSG Justice Center listed right here. Thank you. Have a great day.